Would you be surprised to learn that consuming the wrong kinds of nuts on a daily basis might increase your chance of developing heart disease by as much as 48%, particularly if you are over the age of 70? This statistic is not random. It is derived from research conducted over several years and published in the Journal of the American College of Cardiology. What is even more alarming is that a significant number of elderly people believe they are making healthy choices. In fact, some of the most popular nuts found in kitchen cupboards may stealthily cause harm, including elevating blood pressure, causing inflammation, blocking arteries, and even exacerbating the decline in memory associated with aging. There is a particular type of nut that has been linked to high levels of a toxic component that can accumulate over time and potentially harm the liver, kidneys, and brain function if consumed regularly. I will reveal this information later. Please share your thoughts on this information. Given its frequent inclusion in low-carb diets, it's likely that you already have this particular nut in your snack jar. Don't worry, however, because I will explain everything in detail in the video I plan to upload today. I'll discuss the nuts that are best for heart and brain health, which older adults should consume more of, and which to avoid. This comprehensive and straightforward advice will help seniors choose the right nuts. Stay tuned until the end, as the top nut on my list of things to avoid has a dark secret that few discuss, and it may be harming your health without your knowledge. I would appreciate it if you could let me know in the comments where you are viewing from. Additionally, I would like to remind you to give this video a thumbs up and subscribe to the channel for more natural health and nutrition advice for seniors. Now, let's get started with the top 4 nuts that every elderly person should be consuming. Almonds, which are a powerhouse for bone strength, are among the most ideal foods that nature has to offer for aging bodies. This advantage is primarily due to their extraordinary levels of calcium and vitamin E, which work together to preserve bone density. As we age, our bones naturally become more porous and weak, making fractures a more serious and potentially destructive condition. If you consume a quarter cup of almonds daily, you will get approximately 97 milligrams of calcium, which helps combat the natural bone loss that occurs after age 65. Not only do almonds contain a high amount of calcium, but they also provide magnesium, a mineral that many seniors lack. This combination is what makes almonds so remarkable. The magnesium in almonds acts as a transport mechanism, assisting calcium in reaching your bones rather than accumulating in your arteries, where it could cause harm. Additionally, the monounsaturated fats found in almonds are beneficial for heart health as they help lower LDL cholesterol levels. This benefit becomes increasingly significant as the risk of cardiovascular disease rises with age. I recommend that older adults consume about 15 to 20 almonds daily, ideally raw or dry roasted without added salt. Almonds also contain around 3.5 grams of fiber per serving, which may alleviate constipation, a common issue affecting approximately 40% of older adults. The most surprising finding is that research conducted at Tufts University shows that the unique antioxidant profile in almonds can protect brain cells from oxidative damage, potentially halting the cognitive decline that many fear as they age. When shopping for almonds, look for those with their skins intact, as the skin contains flavonoids that can enhance the antioxidant activity of the almonds. It is essential to remember that seniors who have difficulty swallowing should chew almonds thoroughly, as they can pose a choking hazard if not chewed sufficiently. The third item on the list, walnuts, is highly nutritious. Known as a popular brain food among seniors, walnuts are recognized for their beneficial effects on brain health. It is no coincidence that walnuts physically resemble the organ they protect, the brain. These extraordinary nuts contain the highest concentration of alpha-linolenic acid, ALA, compared to any other common nut. ALA is a plant-derived omega-3 fatty acid that plays a significant role in maintaining the integrity of brain cell membranes and facilitating neurotransmission, both of which are essential for aging brains. Groundbreaking research published in the Journal of Nutrition found that older adults who consumed just 1.5 ounces of walnuts daily for 8 weeks experienced substantial gains in psychological flexibility and cognitive processing speed. Walnuts also contain various polyphenolic compounds that can cross into the brain and help reduce inflammation in brain tissues, potentially halting the progression of diseases such as Alzheimer's and dementia. Many people are unaware that walnuts also contain melatonin, a hormone that naturally declines with age and contributes to sleep difficulties in many seniors. Including a modest handful of walnuts in your nighttime routine may help regulate your sleep-wake cycle more effectively. Additionally, walnuts are rich in arginine, an amino acid that improves blood vessel function, and polyphenols that reduce oxidative stress, contributing to their remarkable cardiovascular benefits. For older adults taking medications to manage high blood pressure, walnuts may be a valuable addition as they help maintain artery flexibility. For optimal health benefits, store walnuts in the refrigerator to prevent oxidation of their delicate oils and aim to consume 7 to 9 walnut halves daily. Whenever possible, crack them yourself, as this provides light hand training that helps maintain fine motor skills. Don't let walnut's strong flavor deter you. It reflects their potent antioxidants. Number 2 is pistachios. Often underrated when it comes to the health of seniors, pistachios are known for their ability to regulate blood pressure. What sets them apart from other nuts is their remarkable potassium to sodium ratio. Pistachios contain around 285 milligrams of potassium per serving, while their sodium content is naturally low. This mineral balance is especially important for older adults, as it helps counteract the sodium-retaining tendencies that develop in aging kidneys. Consuming pistachios can potentially reduce systolic blood pressure by 3 to 5 points, comparable to the effects of some prescription medications, but without the side effects. The carotenoids lutein and zeaxanthin found in pistachios are also noteworthy. They specifically target the macula of the eye, helping protect against age-related macular degeneration, a leading cause of vision loss in adults over 60. Pistachios have a satisfying crunch that is gentle on the teeth and gums of seniors, unlike other nuts that can be harder to chew and may pose dental issues. Their characteristic green and purple colors are visually appealing and indicate the presence of antioxidants, which help neutralize free radicals that accelerate aging throughout the body. Additionally, there is a practical aspect to pistachios that makes them ideal for older adults. The act of shelling them naturally slows down consumption, helping to minimize overeating while providing a focused eating experience that can be both contemplative and stimulating for cognitive function. Research published in the International Journal of Obesity found that the visible empty shells serve as a visual cue for consumption, assisting seniors in better regulating their intake. Those with arthritis in their hands should look for partially opened pistachios, as these are easier to access while still allowing them to enjoy the benefits of shelling. Aim to consume about 49 pistachios, approximately 10 ounces, daily, preferably unsalted or lightly salted. Pistachios contain about 3 grams of fiber per ounce, which helps manage blood sugar levels. A significant benefit for the 25% of Americans over 65 diagnosed with diabetes or prediabetes. The thyroid healing Brazil nuts top our list because they address a crucial but often overlooked aspect of senior health: thyroid function. One Brazil nut contains 96 micrograms of selenium, which is equivalent to 137% of the daily recommended intake. These remarkable nuts are known to have the highest concentration of selenium among foods. Thyroid issues affect up to 20% of individuals over 65, and many cases go undetected because symptoms are often mistakenly attributed to the natural aging process. The selenium found in Brazil nuts is essential for converting thyroid hormone into its active form, directly supporting energy production, metabolism, and even mood regulation. In addition to supporting thyroid health, Brazil nuts contain special fatty acids that help maintain myelin, the protective covering surrounding nerve cells, which tends to degenerate with age. Maintaining myelin may assist seniors in preserving better coordination, response time, and cognitive function. One of the most exciting aspects of Brazil nuts is that they contain a naturally occurring form of selenium that is more bioavailable than synthetic selenium supplements, meaning your body can utilize it more effectively. Moreover, Brazil nuts have a rich and creamy texture, making them enjoyable even in small quantities. This is significant because their high selenium content means you only need a small amount to reap health benefits. In fact, I recommend that older adults limit their consumption of Brazil nuts to no more than 1 or 2 per day, as excessive selenium intake can be harmful. When shopping for Brazil nuts, it's best to buy those still in their shells, as the natural packaging helps keep their delicate nutrients intact for longer. Store them in the refrigerator to prevent rancidity due to their high fat content. Brazil nuts also provide additional benefits for seniors dealing with constipation, thanks to their combination of fiber and natural oils that promote regular bowel movements when consumed regularly. Given their naturally sweet and buttery flavor, Brazil nuts can serve as a nutritious alternative to less healthy snacks, which are often a source of comfort for older adults. Recent studies suggest that the specific antioxidants in Brazil nuts may contribute to maintaining telomeres, the protective caps on chromosomes that typically shorten with age, potentially impacting our cellular aging process. Perhaps the most striking finding is that Brazil nuts contain antioxidants. Seniors should be cautious about certain nuts as they age. Peanuts, despite their widespread popularity, can be inflammatory and present several hazards that make them troublesome for many older adults. First, it's important to understand that peanuts are not true nuts. They are legumes that grow underground. Because of this, peanuts are particularly susceptible to mold, which can produce aflatoxins, also known as mycotoxins. Frequent consumption of aflatoxins can damage the liver and increase the risk of cancer. As we age, the body's detoxification processes naturally become less effective, raising the likelihood of this danger. Additionally, peanuts contain proteins that can trigger inflammatory reactions in many individuals, even those without a true allergy. This low-grade inflammation can exacerbate joint pain, increase cardiovascular stress, and potentially accelerate cognitive decline, all areas already vulnerable to deterioration in older adults. The high omega-6 fatty acid content of peanuts further compounds this issue, as most Americans already consume an excessive amount of omega-6s compared to omega-3s. Furthermore, the vitamin K in peanuts can interfere with the effectiveness of blood-thinning medications like warfarin, a potentially harmful interaction that many healthcare professionals often overlook. Commercial peanut butters can exacerbate these concerns by containing hydrogenated oils, excessive salt, and sugars, all of which place additional strain on the cardiovascular systems of seniors. Even natural peanut butter typically has added salt, which can elevate blood pressure, a concern for the 63% of older adults in the US who have hypertension. Poor storage conditions can lead to rancidity in peanuts, generating harmful free radicals. Acrylamide, a chemical produced during the standard dry roasting process used for most commercial peanuts, may accelerate cognitive decline, which is especially concerning for those worried about memory-related issues. If you have been consuming peanuts without any apparent problems, consider switching to one of the nuts we recommend, even if it's just 3 times a week, to improve your nutritional intake while limiting exposure to problematic components. Number 3 on the list is cashews. Known for their hidden sugar content, cashews are a particular concern for older adults due to their surprisingly high carbohydrate levels and glycemic effect. Cashews, unlike true tree nuts, contain a significantly higher concentration of carbohydrates, about 9 grams per ounce, and a lower concentration of fiber protective compounds. This can lead to a blood sugar response that may be problematic for the estimated 25% of individuals over 65 diagnosed with diabetes, and the additional 48% who have pre-diabetes. This concern is heightened by the health halo effect surrounding cashews, which may lead many seniors to consume them in large quantities without realizing they could be destabilizing their glucose levels. Additionally, the curved and smooth shape of cashews can pose a choking hazard, particularly for those with swallowing difficulties. Nutritionally, cashews are high in oxalates, which can bind to calcium in the digestive system and limit calcium absorption, especially concerning for seniors at risk of osteoporosis. These same oxalates can also exacerbate kidney stone formation in susceptible individuals, with the risk significantly increasing after age 60. The extensive processing required for cashews to remove urushiol, the same toxic compound found in poison ivy, raises additional concerns. Much of this processing involves high heat, which can damage their nutritional profile. Frequently, commercial varieties are roasted in oil and heavily salted, adding harmful fats and sodium that can raise blood pressure and strain the cardiovascular system. Many people are unaware that cashews contain enzyme inhibitors that may hinder protein digestion, which can be particularly troublesome for older adults who often struggle with decreased digestive efficiency and protein absorption. While the creamy texture of cashews is tempting, it also makes it easy to overeat, potentially contributing to weight gain at a time when maintaining a healthy weight becomes more challenging. If you have been eating cashews daily, consider gradually switching to walnuts or almonds instead. Both walnuts and almonds have superior nutritional profiles and pose fewer risks for aging bodies. The second item on the list is macadamia nuts, which, despite their delicious flavor, are considered one of the most problematic options for older adults. This concern arises primarily from their exceptionally high calorie content. Macadamia nuts have the highest calorie count of any nut, with roughly 200 calories per ounce. Given that metabolic rates typically decline with age, this issue becomes particularly significant for older individuals, making weight management increasingly difficult. Their unusually high fat content, around 22 grams per ounce, places additional strain on gallbladder function, which often becomes less effective with age. Approximately 15% of older adults have asymptomatic gallstones, and consuming macadamia nuts may trigger painful episodes that would otherwise go unnoticed. In addition to their calorie content, macadamia nuts contain one of the highest percentages of saturated fat among nuts, about 3 grams per ounce, which can contribute to elevated LDL cholesterol levels, a concern for many seniors. Around age 65, when years of wear and decreased calcium absorption may weaken tooth strength, the hardness and density of macadamia nuts also pose significant dental risks for seniors with crowns, bridges, or compromised teeth. Furthermore, macadamia nuts are among the most expensive nuts, leading older adults concerned about their finances to purchase lower quality versions that may be rancid or poorly stored, thus increasing their exposure to potentially harmful oxidized lipids. Many commercially available macadamia nuts are excessively salted and oil roasted, adding unnecessary sodium and damaged lipids to an already problematic nutritional profile. Their rich, buttery flavor may encourage overconsumption, particularly among older adults who may have reduced taste sensitivity and seek stronger flavors. It is especially troubling that many seniors consume macadamia nuts under the mistaken belief that they are making a heart-healthy choice, unaware that studies supporting nut consumption for cardiovascular health intentionally excluded or limited high-fat varieties like macadamia nuts. Therefore, if you have been eating macadamia nuts daily, consider switching to pistachios instead. Pistachios offer a similarly enjoyable eating experience, but have a far superior nutritional profile tailored to the needs of aging bodies. Finally, pine nuts are considered the most problematic nut for seniors due to their association with several major issues that directly affect older individuals. Alarmingly, they contain compounds that can interact with over 60% of medications commonly prescribed to older patients, potentially reducing the effectiveness of treatments or leading to dangerous side effects. These interactions are most pronounced with drugs often prescribed to individuals over 65, such as statins, blood pressure medications, and certain antidepressants. Unfortunately, most healthcare professionals and pharmacists do not inform their patients about the potential for food-drug interactions, making this situation particularly hazardous. One of the most severe symptoms associated with pine nuts is known as pine mouth syndrome, characterized by a persistent bitter or metallic taste that may linger for weeks after consumption. Taste abnormalities can lead to a diminished appetite and reduced nutritional status, which can be especially concerning for older adults. While some may view it as a minor inconvenience, it can have serious health implications, with studies showing that up to 42% of affected individuals significantly reduce their body weight. Older individuals appear to be more susceptible to this condition, likely due to changes in taste receptors and detoxification pathways that occur with age. Additionally, pine nuts are high in polyunsaturated fats, which oxidize rapidly, producing toxic substances that promote inflammation throughout the body. This is especially problematic for seniors managing inflammatory conditions such as arthritis. Their small size and slippery texture pose a significant aspiration risk, particularly for older adults with swallowing difficulties or those taking medications that cause dry mouth, a condition affecting more than 70% of seniors on multiple prescriptions. Nutritionally, pine nuts contain enzyme inhibitors that may impede protein digestion at a time when protein absorption efficiency naturally declines. The high oil content of pine nuts results in a calorie-dense diet that can contribute to weight management issues, even in pesto, their most common culinary use. Recent findings are particularly concerning, revealing that certain types of pine nuts may contain substances that could accelerate the progression of age-related macular degeneration, the leading cause of vision loss in older adults. After the age of 65, seniors should seriously consider avoiding the 4 types of nuts discussed. As you age, your health energy, and cognitive well-being can be significantly influenced by the nuts you choose to eat or avoid. Ultimately, the small, consistent changes you make can yield the most lasting benefits. I would love to hear from you now. Have you noticed any positive or negative impacts on your health as a result of incorporating or removing various nuts from your diet? Which nuts have had the most significant influence on you? Please feel free to share your thoughts, ideas, and experiences in the comments section. Your stories never fail to inspire me. Thank you for watching.